It's 1940. U.S. forces are preparing for World War II. The Great Depression was finally beginning to ease. Gone with the Wind won 8 Oscars. Nylon stockings were all the rage with women, and jazz sounds were the popular music of the day. In Fremont, Nebraska, the community was celebrating the opening of one of the only hospitals in northeastern Nebraska in their city. A vision that came to life starting 2 years earlier with a campaign for a modern hospital to serve Dodge County, a hospital known today as Fremont Health. The need for expansion became immediately apparent. Just a few years after opening the doors of what was then known as Dodge County Hospital, overcrowding occurred, which led to an addition of a north wing in 1946. Services continued to expand to meet the needs of the community. Longtime Fremonters and hospital volunteers, Coletta Pfeiffer and her daughter Shirley, remember some of these growing pains firsthand.
I remember coming here as a high school student and we sang Christmas carols, and one of my brothers was not in very good shape. He had all kinds of tubes going in him and wires, and I think it was Jeff. And he was out in the hallway because the hospital was so full at that time.
We had double rooms. The beds were so close together that patients could put their feet on each other's beds. We added, at that time, a nice pediatric unit with private rooms, ICU unit, which we didn't have before, and an OB floor. We brought in physicians, urology, orthopedics, ophthalmology, several new programs that helped bring in patients and helped give better care to our patients here in this area.
Facility changes are very obvious. When I first came, this is a pretty basic place. The rooms were small and up to date at that time, but there was no specialization of services. Looking back, I think in early 40s, mid 40s, there were maybe 22 physicians on staff. Now, of course, we have over 70 and have representation of virtually every specialty, either on staff or on the consulting courtesy staff. So, tremendous advances.
In 1971, the hospital's name was changed to Memorial Hospital of Dodge County. The hospital continued its mission to meet the healthcare needs of the community with additions such as a skilled care unit for long-term care and the tower, which included 2 new patient floors.
I think looking back at the 50-year history, at one time when we had 3 operating rooms, there was not a dedicated orthopedic room, so the orthopedic operating table was stored in the basement, then brought upstairs to the operating room when a case was available. Now, of course, we have fully equipped operating rooms and great service. So.
Over the years, the constant refurbishing new surgeons in OB/GYN, general surgery. Our urology department is one of the strongest, not only in the state, but probably throughout the Midwest.
When I came here, Mr. O'Connor was leading the hospital, was bringing in lots of new physicians, expanding surgical things and the advancements in technology.
In 1990, Memorial Hospital of Dodge County celebrated its 50th anniversary, and the nursing home was officially renamed A.J. Merrick Manor after Dr. Merrick, a Fremont physician. In 1996, the name was changed to Fremont Area Medical Center, ushering in a 17-year period of increased growth, including the addition of a 20,000 square foot imaging center, outpatient services and clinics, and enhancements to the only emergency department in Dodge County, seeing over 15,000 visits per year.
Since I've been here, we've remodeled the ER and moved the ER. We've done Health Park Plaza, we've done the imaging center, and now the big hospital project, and of course added the clinics. So we're able to keep a lot sicker patient in Fremont and to do exemplary care just as they would receive in Omaha.
The corridor of healthcare right up and down Clarkson Street. I mean, access to all these specialties, subspecialties within a few minutes of the bases here at Fremont Health and the emergency department, all that within easy access.
And while there are many milestones in the hospital's 75 years, what makes this organization so special is the passion and compassion demonstrated every day. It is the amazing stories of hope and healing that touch lives from generation to generation.
My husband and I had 14 children. 12 were born here at the hospital. I had 5 grandchildren born here.
I was born and raised here, and my wife and I have 3 children that were born here. For some of the nurses that they're still here, that were involved in the births of my children, and they still ask about them, and you think back to that day, and because I can see their face, or I can still see their face now when I walk into the ER, and it makes me think back to 26 years ago that they were there.
My fondest memories get all commingled with coworkers and patients. What I'd have to boil it down to is watching us come together as a team to help save a life. That goes on here routinely, and it is exceedingly rewarding for everyone involved, most certainly the patient and their family members.
It is the commitment to the community and from the community that has helped our hospital not just survive, but thrive for 75 years. Over 200 volunteers generously give their time, offering a welcoming smile or a helpful hand. And philanthropic support to the Hospital Foundation helps continued growth, expansion, and enhancements impacting individuals and families, and is a vital part of our future.
The foundation, I think, is another way that the hospital is more than it would be without the foundation. The foundation is able to raise money to add things that probably would not be in the budget otherwise. I've seen the hospital grow, and I think it's important for the community, and I think we all need to give back in some way to our communities.
In 2013, we embarked on a journey to transform healthcare in our community with the announcement of Building a Healthy Future, a project focused on elevating the patient and resident experience. In 2014, a new name and philosophy were unveiled that represents our expanding Fremont Health system. As part of that change, A.J. Merrick Manor was renamed Dunklau Gardens in honor of longtime board member and supporter Rupert Dunklau.
So we're going to work to keep our people out of the hospital, provide them health and wellness to keep them from becoming sick, and using the hospital as a way to help them through those difficult times that can't be taken care of in that situation.
I am very proud of how progressive we are. We are truly not just your typical community hospital. I'm also very proud of the fact that we are strong and independent, and that is not easily accomplished in this day and age.
The mission of the hospital has been the same since even 1938, 1940, and that mission has been carried out to a great extent because of the people involved.
As we chart our course for the future, we remain committed to excellence by preserving our independence and maintaining our local governance.
The leadership is extremely important as far as what the future holds for this hospital. The hospital has been dedicated to service in this community and the Fremont area, and certainly it's the intention of the board to continue to provide that very quality service for a long time.
We are truly friends and neighbors taking care of friends and neighbors, offering amazing care at home. And I know that's important to a lot of people in the Fremont community, in the Fremont area.
Our mission remains focused on improving the health and wellness of individuals in the communities we serve. And we will continue to build from the foundation from which our doors were opened in 1940. A hospital right here in Fremont, your family hospital in your community, leading the way for generations to come.
I'm so confident that my family goes here, I go here. I trust them with your life, my patient's life, my life.